So, welcome to PNR 204 Exam 1 review. Your exams will be next week. Just to let you know, those who are not in my class, you're going to find this recording quicker on my YouTube channel. If you go to Professor Bogart, Pediatric Nursing, it will be listed PNR 204 Exam 1 Review. So you'll be able to listen to it quicker than waiting for your professor because it goes there first before anywhere, okay? So here we go. During this, if you have any questions about anything and you're not understanding, I tell you, please stop me, ask questions. I do not mind questions and ask all that you need to. So there are a lot of things that we do cover in the exam one. The one thing I want you to be aware of, it's very heavy on theorists. So make sure you know your Erikson, your Piaget, your Goldberg, and also try to understand Maslow. And we're going to go through that coming up. So there are a lot of definitions that you need to understand um, to be able to, describe things in pediatrics. So let's go over them. We'll go one by one. So here we are, cephalocaudal. Well, cephalic is head, right? So head, cephalocaudal, and caudal is your toes. So that means you lift your head up first. Then you start to roll over, you crawl, you creep, and you walk head to toe. Simple as that. Proximal distal. Now that starts with you can see and work with your hands here and stuff, and then you start working around. So it starts your vision close to you, and then you start working to your surroundings. General to specific is just basically performing general physical functions, walking, and then you could describe the walking as specific. Maturation. One of the most missed definitions, I think, is maturation. And it is the total way in which a person grows and develops. And that is dictated by where you come from, your inheritance. You're not going to grow tall if your family's all short. So basically, that's the maturation. Growth is just basically growing. What does an infant do? They start at 7 pounds, and by 1 year, they're 21 pounds. Increase physical size. And we know they're growing 1 inch per a month for the first 6 months. Growth, they're growing a lot. Development, it refers to the progressive increase in the body's function. Well, we start out with not being able to eat that much, and all we can eat is milk. And then we go into being able to eat more food. And then we get into potty training where we're holding the urine, holding the stool. So your body functions getting more and more developed. Heart rate starts real high. And as we get older, it gets lower because it's more efficient being slower. Now, heredity is a factor that develops maturation, okay? Again, it's part of the way that you mature. It's where you come from. They're both interrelated. Nuclear is a type of family. That's when you have the traditional mom and dad, they get married, never divorced, they have children together. That is a nuclear family. The extended family is where we have grandma and grandpa, and you have children from other people, relatives, aunts and uncles. It's all your extended family. It could be a church family in some cases. Blended is where, for instance, my family, I was divorced. I have 2 children. My husband has 3 children. And together we have a blended family of 5. That's what that means. Alternative is that communal families. We see that a lot with your migrant workers. We see a lot of that. Church families also are that alternative, and they basically function together and lunch and dinner together and pray together, et cetera, et cetera. Exclusion reflex is when we start to feed the baby food and their little tongue starts to stick out. You put a spoon in there with the rice cereal, because that's number one food that we're going to give because it's less allergies, less allergenic to foods of all of them. And you put it in the mouth and the little tongue sticks out like it's pushing it out. It's because it doesn't know what to do yet. It hasn't learned how to put the spoon in and take it off and swallow it. And eventually they learn. It's just like when they're born, they need to learn how to suck, swallow, and breathe. Now, grasp reflex is when the palms and the flexion. That means you put your hand out and they grab a rattle. That's a grasp reflex. It starts out with a reflex, but it goes into voluntary. And that's basically grabbing a rattle. Prehension is the ability to grasp objects between the fingers and the opposing thumb. It's almost a pincer type of grasp. They can take these two little fingers and pick up a Cheerio off of a high chair and put it in their mouths. Parachute reflex is a protective thing. It's just like a cat. You throw them up, they come down on all their paws, right? Well, think about an infant. You put them face down, going into a crib to put them for nap, let's say. Their arms and their legs come out because it's protective, all right? And it's called a parachute reflex. It's usually about 9 months that happens. Now, negativism is toddlers. What do toddlers know? They know no, 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 me, mine, mine, mine. So, negativism is the way that they're just testing themselves. It's the word they know. They can say no, no, no. And it's because they're fighting to have the autonomy that they want, like Erickson says, right? They want to do for themselves. Ritualism is putting a kid on a schedule. That's the other word for it. Toddlers really need it. And the reason is because they know what's coming next. They know when they wake up, let's say we change them and put them in their day clothes. Then they have their breakfast. Then they can have playtime. Then they have nap time. Then they have lunchtime. They know what's coming next. When is bath time? They understand the rituals of the day. And because of that, they feel comfort. That's the security. They don't like change. Now, personality is those unique organization of characteristics that determine the individual's typical or recurrent patterns of behavior. It's who they are. Are they the child that's happy and smiley, or is it the child that tends to cry a lot for things? It's just their personality. You have, that happy baby, and then you have the quiet baby, right? Parallel play is typical toddler. Why is that? Well, parallel play is two children or more, doesn't matter, playing next to each other, but they're not sharing, they're not playing together at all. This is my toys, that's your toys, and you don't touch each other's. Parallel play is toddlers. You ever asked a question? Parallel play? Oh, that's toddlers because they don't like to share. Egocentrism is a type of thing and that doesn't recognize any point of view other than the child's own and is common in toddlers and preschooler. So they think what they want when they want is when they should have it. It's all about ego, all about me and mine, toddler. Preschoolers, it's less, but absolutely your toddlers. Now, growth and development, what influences it? Well, how do they grow and how do they develop, get cognitively aware of their world around them? Well, it's their heredity, and their nationality and race. There are some, hereditary, some of you have a bunch of smart families, and some, because that is going to be inferred on the children, right? The nationality and race, we have some that races that just sit there and just do all of these things like games and teaching letters and colors at early ages. And it's just part of the way that they were brought up, their culture, their nationality, and their ordinal position within the family. Is it the first child, or is it the middle child, or is it the last child? And sometimes we know the first child gets all the goodies, and then as they come along, more than one, sometimes they don't get as much of that parental guidance as would say, the first child. And there is a difference between boys and girls. And the environment. If you live in an environment where there's drug abuse, alcohol abuse, or just physical violence, that does affect how a child grows even poverty and homelessness, all of these things, that does affect the way that they grow and they develop. Now, we mentioned a little bit about, the blended family, etc. Well, parenting styles. Well, the authentic is that one that's nurturing, affectionate, sets the boundaries and disciplines through guidance, and there's that open communication. I think that's many of us. The authoritarian is the one that has that strict, inflexible, high expectations, and then they punish over that discipline. I mean, that's the parent who wants everything done right all the time, and there's no excuses. Indifferent is the one that they're emotionally detached, no boundaries, little interaction, they're self absorbed. Again, that could be due to they're worried about themselves and their own environments. It could be, again, a drug or an alcohol abuse, or it could be homelessness or poverty, and they're just worried about the next meal, etc. And they just don't have time, to spend with the child. And that could be that indifferent. Now, permissive is when the child can do whatever they want, whenever they want to, because the parent wants to be a friend, rather than a parent. And young children do need those rules and those boundaries. It doesn't mean that they're not nurturing, affectionate. Yeah, absolutely, they love their children, but they are letting them get away with too much. And then when they get put into school, guess what? There tends to be a lot of problems because there's been no boundaries at all. Discipline should be focused on teaching rather than punishment. So, timeouts are what we do with our children. And in timeouts, it's 1 minute per year of age. That child needs to sit down, be quiet, and you tell the child what they did wrong, why they're being disciplined, why they're on a timeout. That's the teaching, okay? And then let them sit for the 2 minutes, 3 minutes, whatever it is, depending on how old they are. Now, let's get into some of the theorists. I think that this is the one that many of you do struggle with. So let me try to explain it in a manner you can understand. Well, what does an infant, 0 to 1, what do they do? What do they know? Well, initially, all they know is to suck, swallow, and breathe. And how do we soothe an infant? That's with a pacifier, right? So how do you self-soothe? They put the pacifier, they put a finger in the mouth, they put a toy in their mouth. How do they explore the world? It's in their mouth, and that they receive pleasures from. Now, in toddlers, we start to potty train, right? And we know bowel training comes before bladder training. So that's why we call it anal. As you can see with Freud, it's always something sexual going on here. In the preschoolers, that phallic stage, this is all about boys are attracted to their mothers and girls are attracted more to their fathers. And again, there's that exploration going on about their sexuality and they're touching themselves. Now, latency. I don't know why the word is latency, but all in Freud is saying is that children are now breaking away from the family and do have same sex peers, which are their friends. So now they're talking to other children and sharing culture, actually. So this is same sex peers. And then in adolescence, it's the genital age. This is when the hormones rage and they're starting getting attracted to whatever they're attracted to, the same sex, the opposite sex, whatever. This says the opposite sex, but we know that there's more than that in this world. So, breaking it down again. Orality in Freud is all about the world in their mouth, right? Finger in the mouth, pacifier in their mouth, toys in their mouth, their toes in their mouth when they can reach their toes, right? Anality, again, is all about the toddler stage. Again, it's bowel training before bladder. And we know that toddlers is all no, no, me, mine, let me do. And they get into the little temper tantrums, and it's normal for toddlers. We get into the preschoolers again. This is more about knowing about their body parts because they've gone through body training. They've seen mommy go to bathroom, daddy go to bathroom, and they've seen that they have parts that they have and not, and then they're starting to touch themselves. Normal exploration of themselves. And then, as I said, Freud in the latency, which is your school age, is all about same-sex pairs, and that, they're getting along with them. And they're not the same culture, so they have to accept other people. Now, Piaget, like this is one I think is the one that's difficult because of the names of these things. Just think of Piaget as you're born, you don't even know how to breathe. We have to spank your feet or your butt, right? And they start crying, and now they learn how to cry. Then somebody puts something in their mouth. Maybe it's to feed, maybe it's a pacifier. Now they learn how to suck. Now they're sucking, swallowing, and breathing when they're feeding. That's the first cognitive awareness that they have, okay? Then it goes on to learning that there is a rattle. And then they have that voluntary grasp. Oh, I like that. And then all of a sudden they shake it and there's a noise. Oh, I like that sound. And they do it again. And then, of course, it goes into the mouth. So this is part of the sensory oral motor. So sense, touch, feel, ori, into mouth. Motor is the movement of it. And then something called object permanence. You take a toy, the baby sees it, infants all the way up to whatever age child, they've seen it, they know it's there. So we call it object permanence. So even if it's not in visible sight, they know it's there. Not that you hit it, it's just that they're looking for it. And this is where we put them on tummy time and they go looking for these things. Maybe they want that rattle. Pre-operational is now they start thinking a little bit more, and understanding. They have given, arms out, and they're an airplane, and they have a broom, and now they are riding around like an airplane, like a horsey, or, um, it goes into, more of being this magical, imaginative child. And conservation is something that's sort of difficult to understand. It's basically understanding the matter around them, whether it's liquid or solid. Think about that glass of water. You take a tall, thin glass and a short, fat glass, and you put, one side or the other, the same amount of water. That little younger child is going to pick the tall one because it looks like more. And then maybe some child as they get older, realize it's the same. And they'll say, no, it's the same amount. It's like taking clay and a big ball or a flat ball of the same amount is still the same. And that's what conservation means. Now, Piaget thinking, cognitive development, school age children, what they say with concrete is something you can feel and touch and smell. So you've seen it before. You've touched it, you've watched it before. When you've seen it, you can understand it, that you can redo it again, okay? So, but you can't make up your own concepts by yourself yet. That's the formal operations of that adolescent. As I say with adolescents, if they want something, they're going to figure out whatever way they can to get mommy and dad to let them do it. And they can think this. They don't have to have seen somebody else do it before them. So concrete, they've done these things, seen it before. Formal is when now they figure out how to get out of situations. So we've really gone over more of these things. Um, those. Erickson. Now, I think Erickson's probably of all of them, the most of all tested theorists. You're going to see it on your Hessian NCLEX for sure. I put the whole, stage of life here, but we're just going to go up to the point where it is identity versus confusion or role confusion, okay? So let's go into them. Infants. Infants, according to Erickson, if when they cry, somebody picks them up and takes care of their needs, is a happy, healthy, really satisfied baby. The mistrust is when that infant cries and nobody comes to take care of them. This could be again due to, these home situations, could be the drug abuse, could be alcohol abuse, could be homelessness, could be many things, and they're crying and nobody can pick them up because they're doing other things. So trust, they're happy, they've picked up right away, their needs are met, they've been fed, they've been changed, they've been burped, whatever they need. And then mistrust is they have to wait. Now, toddler. Autonomy, automatically mine is what I say autonomy is. And automatically mine is I want to do, I want to try, let me try. Now, times you have what we call the helicopter parents that are always behind the kid, making sure that they put their shoes on, that they make sure that they're not going to fall down. They make sure that whatever, they don't let the kid try. That is shame and doubt. Toddlers, those ages 1 to 3, should be having the ability to try things by themselves. It does not mean they're doing it right, and they shouldn't be, punished or criticized for not doing it right. It's that they tried. That's what should be said, and then say, well, if you did it this way, it probably would be better. Could be that, feeding themselves spoons upside down and backwards, but they're trying to get it in their mouth, right? It's a try. They're still getting food in their mouth some way. It could be dressing, could be their shirts are backwards or their shorts inside out, but they're attempting it. That's the thing. Preschoolers are the at the age of initiative versus guilt. Now, initiatives, they like to go around, they like to help. These are trying to, help mommy set the table or clear the table or get the laundry for them, whatever. And the guilt is when they can't do it all and they want to do it all. Now, it's sort of similar to school age, and it's industry versus inferiority. Well, think of the industry as a factory, a product that the child produces. This industry is things they do well. Now, some children are good at school, some children are good at sports, and some kids are good at both, but they don't do everything well. So, what they do well is their industry. What they can't do is they feel inferior about it. They want to do everything well, but they can't. So industry is something where, I'm good at spelling and they like the praise from other people and the recognition. Wow, you're really good at spelling. Or wow, you run really fast. Then it gets on to identity versus role diffusion, and that's your adolescence about adolescents. They are in that time where they've got to figure out what they want to be when they grow up. They got to figure out the sexuality because their hormones are coming into play. Do they like girls? Do they like boys? Do they like both? These are decisions. Do I fit into the art club, to the gym club, into the drama club? Finding their group in order to fit in because it's important for them to fit in with a group. Okay. So, identity, and this is all body image too. What do I look like? How can I look better? Now, Maslow's hierarchy of needs, sort of confusing, but let's just do the top and the bottom. Well, your hierarchy of needs, what do you need to live? You need food, you need shelter, you need sleep, and you need, bathing. That is the basic physical needs. And what is the esteem? That's letting that child go to ballet and be in the ballet class because they're so good at it and they feel good with doing it. That's what gives them esteem and makes them feel good and gives them the praise that they need. And then there's all that in between, okay? Now, Goldberg. Goldberg's all about right and wrong. Now, infancy and toddlers don't really know what that is yet. Okay. Yeah, the older toddlers a little bit, but as far as Kohlberg and you understanding, know that preschooler is all about reward and punishment. If I do something good, I'm going to get a reward, whether it's praises from the parent, or maybe some sort of, you know, going somewhere that they wanted to go, and then if they're do something wrong, there'll be a punishment. There'll be a timeout. There'll be go to your room type thing. So reward and punishment. When we get to school age, it's all about pleasing. Most children, according to Kohlberg, that are school age, they do everything to please. They don't want to do wrong. They want to do the best that they can. And then as they get older and they get into adolescence, it's all about society and the rules of society. You know, whether it's driving and stopping at a red light or a stop sign. I mean, that's the rules of society. Um, it's, if the store is closed, well, you can't get in, right? It's using the right door, the right whatever. So it's the rules of society, is Kohlberg. So basically, I went over all of them. Those are the names. I don't, have the names written there. It's mostly the concepts. So infant. Well, infants are from 0 to 1 year, but the first 28 days, they call them a neonate. Okay. At 29 days, they are now infant. All right. Now, gaining weight and height the first year. I just marvel in the feeling that these children born at 7 pounds and can't even lift their head, they learn how to suck, swallow, and breathe. And by 1 year, they've tripled their birth weight and they have grown an incredible amount. And they also now are walking or attempting to walk. The thing that you need to know is the birth weight doubles by 6 months. So a 7 pound child would be 14 pounds or thereabout. And by 1 year, they triple it, which should be about 21 pounds. And if they're too much or too little, an intervention will take place. Do we need to give more calories or do we need to look at what a parent's feeding them because they're too much, weighing too much? Another thing, as I said, their height is increased by 1 inch per month for the first 6 months. You can see why they eat so much. They're trying to catch up with this. So an average infant should be about 29 inches by the first year. Big milestones, we know infants by about 1 year should be or close to taking independent steps. They might take one step and fall down. As I said, sometimes it's not 1 year, it's a little bit later, but as long as they're standing up, attempting to walk, that's all we want to see. And then the first teeth should be coming up about 6 months. It doesn't mean they're coming up at 6 months. My kids never had teeth at 6 months. They got 8 at 15 months. So again, as long as you can see them start to come. So the trust is infancy makes that happy, healthy baby, that good, healthy personality. Sensory stimulation is essential because you're teaching that child to think, right? So that sensorimotor, that shake, the feeling, that sensorimotor is the touch of it into the mouth, looking at colors. And this is all teaching them to learn. Now, as I said, sometimes you have that quiet infant. Well, the techniques to cope with this quiet, lethargic infant are things like having the lights not so bright. They don't want bright lights. You cannot move or this child around fast. It has to be slow and gentle. If you are talking, it should be in a very calm, quiet voice. And you need to have this child sitting up to look at their environment at some intervals. Health maintenance during the first year is to make sure they're gaining weight and they're progressing in their gross and fine motor skills through the first year. And it's also to provide those immunizations because they're born, they don't have an immune system. So those immunizations will give them that defense against them. And of course, it's always to educate and support parents. So, infant safety. You should never leave a child unattended in a bath because even a little bit of bath water they can drown in. And they should never be on an elevated surface unless they have a harness on. I've seen young 1 and 2 month old babies fall off of changing tables and beds and couches, and they've hurt themselves. They've got big bruises on their head, so never leave them unattended. For safety and sudden infant death, infants should never be on their tummies, should be always on their back on a firm mattress. Okay. And then you're going to say, well, the back of my baby's head's getting flat. Well, you place them on their abdomen during playtime, tummy time, and that actually helps that scalp from not being so flat. Remember, car seats should be rear facing for an infant. That harness should be snugly placed around them. And you can use rolled baby blankets to snug them in there tight so they're nice and tight in that car seat. Car seats should not be used for a sleeping arrangement. I know many of my friends used to take their kids and put them in a car seat and drive around when they wouldn't sleep, but it's not recommended according to the book. So again, car seats, rear facing, up till 2 years old. At 2 years old, they could be turned around and rear facing. And remember these car seats, and many of us don't do it. They should be in the center of the automobile on the rear seat. Okay. And those car seats, make sure that they are secured into the car with that seat belt. Those little sling carriers are really neat and they do help the baby feel snug, but make sure that their nose is out and that they can breathe. Remember, they're obligatory nose breathers, and you obstruct that, they can't breathe. Breast milk or formula is most desirable food for the first 6 months of life. And then after that, we start to solid foods. Now, what if a mother can't breastfeed? I was one of those. They didn't work, and we didn't have those great pumps many years ago when I was a mother of my first. Remember, they can always have iron fortified formula. It is the next best choice for an infant. Can't breastfeed, it's okay. Fortified formula is the next choice. Now, some parents, when you start introducing food, want to make their own. Make sure, and this is important, not adding salt, only using sugar sparingly. Never honey. We know that can cause problems. After age 1, you shouldn't be using honey. And whole cow milk shouldn't be done before age 1. And it's always whole milk because they need the fat, okay? So cooking the food should be tender, but on a little bit of water. We don't want to make the volume full of water. We want it full of food, okay? And we should strain it or puree it to get little chunks out of it so they can't choke on it. And you can put them in an ice cube tray and you can pull out one little cube for a single feed because 1 tablespoon of food per year of age is all they need for food for feeding. So it's actually a great thing to do. As I said, as we introduce solid foods, rice cereal is the first choice because it does low risk of having allergies to it. So high quality fruits, vegetables, and meat should be selected if we're going to be doing our own foods. If not, the foods from the grocery is fine. Again, only one food in the jar. It shouldn't be mixed vegetables. It shouldn't be peas and carrots. It's just one peas or carrots or green beans, whatever, one at a time. And we should give them one at a time with 4 to 7 days in between introducing another one in case they get allergies, right? Another thing we can start to introduce is fruit juices, and they should be in a cup, not in a bottle for this. The little sippy cups we can start offering. Remember, we always give food first before we give milk or juice. Now, alcohol is the most abused substance by women of childbearing age. And, if a mother is, pregnant and drinking, these are the things that can occur to that child. They say there's no safe level of alcohol ingestion during pregnancy. It can cause growth restriction, intellectual impairment, facial abnormalities, and then they could be cognitively delayed. So they're not going to communicate, they're not going to be able to be in social situations, smiling and cooing back at people, and their motor skills are going to be low. They say an intake of one 12-ounce beer or wine cooler, or one 5-ounce glass of wine, or 1.5 ounces of 80 proof distilled spirits, that's not your hard liquor, once a day can cause serious effects to a fetal development. So, something as nurses we can teach our pregnant parents. Now, toddlers, ages 1 to 3. By 2.5, their birth weight has quadrupled. We've gone from a little baby and now we're getting into more physical changes. Their fine and gross motor skills are getting more and more refined, and now we're more mobile. And now that eye-hand coordination, depth perception, all of that's getting better. They start to do potty training. Again, as I said, bowel before bladder. And, they're starting to be able to talk. Um, Words, and they're liking it. They're understanding more than they can speak. But it is they are mastering these things. If we're potty training, the one thing, don't leave them unattended, and they should not be punished for accidents, because again, it's a process of learning. They say sphincter control, about 18 to 24 months, and we know some toddlers are there later on, which as long as they're trying, it's okay. By toddlers, they should be able to have 3 meals a day. As infants, we're feeding them every 4 hours, every 4 hours, right? So as they get to toddlers, it can be 3 meals a day, probably snacks in between, right? By 2 years of age, a toddler should be able to feed themselves. As I said, it may not be the spoon upside down backwards, but they're feeding themselves. They should not be on a low-fat diet before 2 years old. Even a bigger baby, maybe their weight's high, will never restrict fat. They need it for their growth and development, for their brains, okay? And complete bowel and bladder control is about 2.5 to 3 years old. So again, Erickson is all about autonomy versus shame and doubt. That means let a kid try to do it. Don't try to do it for them, because when you don't let a kid try, they're going to look at themselves and have shame and doubt. We know cognitively, this is Piaget. I don't know that they're getting smarter and understanding. Well, they're listening, they're understanding, and they're speaking a lot more. Separation anxiety is part of it. It's one of your discussion questions. It's about protest, despair, and detachment. When you take a toddler and a parent has to leave, that kid's going to scream and yell and go bonkers and crazy because they're used to mommy being there. That's protest. And then they realize mommy's not coming, and they go in despair, and they regress a little bit. Maybe they're incontinent when they're potty training, or they start sucking their thumb where they hadn't before. This is normal. That's despair. And then detachment is when finally mommy comes and the baby wants nothing to do with mommy because, they've been gone. And those are the 3 stages of separation anxiety. We know that you do, as a parent, they need to have some guidance to handle them with their negativism, their temper tantrums, and their sibling rivalry. I mean, they're not allowed just to go crazy and no, no, and scream and lay on the floor and go crazy. No, we have to make sure that they understand that there's a limit to that. I say with temper tantrums, as long as they're not hurting themselves or can be hurt, let them have their moment because temper tantrums, they want you to pay attention to them. So again, discipline should not be a punishment. It should be a timeout where you set the limits, and this is the teaching. Preschoolers. Preschooler is all about trying to get into school, and this is the development of cooperative play, which means whereas toddlers play next to each other and don't share anything, these preschoolers, now it's two or more children playing together, sharing toys with a goal. Cooperative play, there's a goal in the end. Whether you're playing the older kids checkers, somebody wins, or let's build a train track and the train track's completed. That's a goal. Okay. They now are potty trained. They are able to be separated from parents a lot more. And now they're talking a lot better. Communication skills are better. And I'm telling you, their memory is amazing. They don't forget a thing. And their attention span, because they have to get ready for school, right? They have to sit. I mean, 15 minutes sitting for these age children is a good time span, to keep their attention. So preschool is ages 3 to 6. Gross and fine motors are more and more developed. These children now can run, skip, and draw pictures and use scissors, right? And Piaget is now in preschool is all about they're starting to think magical thinking, these thought processes, and their language is coming about. And I'd say in some of the words, that language they're coming doesn't mean that they mean anything, but they like the words. I tell everybody the big word that my grandson used to like to use was teleportation. Where he found that word, I don't know, but it's the language that, and he used to talk about teleporting all the time. Erickson's all about the development of initiative, wanting to try and to help, right? And Kohlberg is that moral right and wrong, again, reward and punishment. Their language is much better. Big, complicated sentences are coming in. Playing is a big thing. And being able to play with other children with a goal, is what they need to learn because now they're getting ready to go into society, right? Work with other people, go to school with other people. And it's what they part of their growth. These preschoolers, they're starting to learn how to share and not getting angry when somebody takes something from them. Just go and, I mean, a toddler, you take a toy from them, they're going to go up to you and hit you. They want it back. Well, a preschooler has learned now they can control them. Common concerns are from parents how to set limits, like what is right, what's wrong, how to say, well, no, we can't do those things. Jealousy is a big thing, with brothers and sisters, and it could be cousins. You like this one more than you like me, and they're going to be saying these things. Um, some sucking, they usually will stop before school age. Um, and of course, they're in sexual curiosity. They've learned they've got these body parts, and now they will be touching themselves and masturbating. Primary enuresis is a child who's never been dry at night. Now, you have a baby, preschooler, who's never been dry at night and they urinate at night. It's not a big deal, sort of expect it. But what if you have a child who's not been wetting their bed for at least a year? They have something called secondary enuresis. There's something going wrong. Is it a urinary tract infection? Is it diabetes mellitus, diabetes insipidus? Something's not right and that needs to be looked at by the medical community. So it's a nice big scale for you to look at, to go over it. I basically have said most of those things there. Now, school age. School age is now ages 6 to 12. It starts out with the beginning of losing their baby teeth. It ends up with all their permanent teeth, and they go into puberty. That's what it's all about. They start to, their thought process and skills are getting more and more refined. Erickson says stage of industry or accomplishment, which means there are many things I do well, whether it's playing a piano, whether it's cooking, whether it's, spelling, whether it's running fast. I do it well. People mention this about me, and oh boy, does that make me feel good. And remember, the inferiority part of it is those things I can't do everything well. Freud is all about same-sex peers, playing with other peers and being able to get along with them. Piaget is talking about concrete operations. Concrete, you can feel it, you can touch it, you can see it. They've seen something done before, they can do it by themselves. They don't have to be shown again, they've seen it. Their growth, it's up and down in school age where it slows down. But think about ages 6 to 12, it's a lot, but it's up and down, where they get heavier and taller and heavier and taller. These children also now are getting a really good self-concept, who they are, that they're being accepted, and these things are good. And a lot of it has to do with their industry, what they do good. And as I said, it's same-sex peers up to about puberty. Their language now is they're able to communicate everything and fully understand things. Their moral development, they know right and wrong. And as I said, they want to please, they want to adhere to the rules, they want to do well. Maslow, let's say we're talking about that hierarchy, that top of that pyramid. You want them to feel good? Well, put them in things like team sports or physical education, and they do really well and they feel great about it. That's their esteem. That's good. And how would you address a child who's struggling to focus and paying attention? Well, these children, it's something you need to speak with parents about. Are they having that at home? They could be ADHD, right? Something's going on there and it does need investigated. And then latchkey kids. Well, those are the children who have to go home, then there's no adult there. Know that the one thing is that there's a higher rate of accidents. Also, because they go home to nobody, they feel abandoned, isolated, and alone. So they feel less than. So latchkey kids, some of them have to be. That's just, some parents don't have choices, but know that there are more accidents. And then adolescence. This is where they start to grow up and be more mature. They start, getting breasts and they start maturing and going through puberty, right? Erickson, as I said, it's all about their identity, body image. Who am I? What do I want to be? It's that break away from family and now having other people, as part of their life. They're starting to break away. So by the time they move out of the house, they've dealing with other people and other ways of thinking. Freud is all about, the sexuality, it's that exploration. Piaget is all about what we call abstract reasoning and logic. It's formal operations. It's like school age, but they don't have to see it. They just figure it out. They know what to do. I always take the example is you tell your child they can't go out on Friday night because they did whatever. And this child wants to go out Friday night because they're all going out to the basketball game and they want to be a part of it. So they know what they have to do, abstract reasoning, that mom and dad will say, you've been good all week. Okay, you can go. That is formal operations. Their physical development is getting more. We know that they're getting their, all of their, body parts and they're getting curves. They're becoming tall men and curvaceous women. All of those secondary sex characteristics are coming out. One of the things about adolescent years is they're going through a really, really rapid physical change. And the thing is now they're becoming more conscious about themselves. As nurses, to maintain their privacy, having how are they dealing with their stresses and pressures? They don't want to talk to mom, but they don't want to talk to their peers. It's a very frustrating time of life, okay? And then so number one hazard and kills many adolescents. Well, whenever you talk about anything that has to do with safety and accidents, motor vehicles. Number one, they're now driving, and they tend to be, have less of a filter of what's right and wrong. They just want to try it because it seems like fun, right? Remember the nursing process. It's that ADPI, right? It's the assessment, it's the planning, the implementation, it's the evaluation. Assessment is when you're just looking, right? And then collecting any data. So, determining appropriate nursing issues, diagnosis related to parenting, coping skills, and unmet developmental needs is part of this analysis and nursing diagnosis phase. Now, there's something called a Denver 2 test. Has nothing to do with IQ. Nothing. But what it does, it looks at their personal, social, fine motor, language, gross motor skills and say, this kid needs more evaluation. They're not where they should be. So it helps. It's like an early intervention, catching them up. Okay. So it's just a measurement of, who they are and are they where they should be. And if not, making sure they get what they need. So how do you do timeouts? As I said, 1 minute per year of age. Tell them what they've done wrong, and the clock will start when they're quiet. Now, when we're giving medication to children, the most accurate way is their BSA. You will see many times in pediatrics, the reality is milligrams per kilograms, micrograms, units per kilograms. They don't always use a BSA, but according to the book, BSA is the most accurate. And how do we teach sex education to adolescents? Well, first of all, you got to understand what they know. And we know that we can give oral and written information to adolescents, and we don't need parental consent for that. If they're asking, we can tell them. And the leading cause of death among children is accidents. And as I said, the number one is motor vehicles. So, medications for children is that BSA. Remember, in children, just like the adults, it's the same end of the spectrum, one end to the other. It's absorption, distribution, metabolism, excretion, the way that their liver works, their kidney works. These all make a difference on how we give drugs to children. Also, these children, the way that they respond to drugs is different than and less predictable than adults. Some children might have a reaction the first time they're given an antibiotic, and it might be the last dose they have a reaction to. So they're really much less predictable because their bodies are still immature. Weight measurements must be accurately recorded in kilograms. Remember, as I said many times, you're just going to get that to do milligrams per kilograms. And remember, with medications, it's either per day or per dose. And if you're doing exam questions, make sure you look for the answer. Is it per day or per dose? And then IM injections for children is their vastus lataris, which is your upper outer thigh. IM injections for adolescents is up into the arm, the deltoid, or up into the hip, the ventrogluteal, okay? Now, when you have a child with IV fluids. Now, today, you guys are really lucky. When I first became a nurse, we did not have IV pumps at all. We didn't have them for anyone. So make sure, though, if we have to just hang an IV with no IV pump, make sure that you're not overloading them with fluids, okay? And then as we get those pumps, make sure that they are put the right rate to make sure that they're not getting too much because they'll go into cardiac failure, congestive heart failure. And Any child on IV fluids will need an intake and output sheet to make sure that we're accurate. Infants, as I said, self-soothe and explore the world in their mouths. If they are NPO because of a physical condition or postoperatively, make sure that you give them a pacifier because they will soothe themselves with it. It's really important for good growth and development. And then how do you know how much output an infant has? They're in a diaper. We have nothing to measure it. Well, you really do. What you're going to do is take a diaper, let's say it's size 1, it is 30 grams, and you take a wet diaper off that infant and it weighs 60 grams. You subtract 30 from 60 and you get 30 grams output. 1 gram is 1 ml, so that was 30 mLs of output. Very easy, very simple. Now, CPR, you'll always see a question about CPR in your exams. So infants, something happens, and they've got an obstruction, they're everything in their mouth, right? They could swallow a little toy, a little whatever, and it gets caught. How do you relieve that obstruction? Well, an infant, it's the chest thrust and back blows, and an older child, it's going to be abdominal thrusts. And then you know it when that toy comes out. Never stick your fingers in there. So, as I said, medications, it's always milligrams per kilogram. Remember, they do change. Kids get big quickly. That's why we do weights and heights on every child in every visit, whether they're in a hospital, urgent care, or the doctor's office. We follow it very, very, very closely. Kilograms is 2.2 pounds. So kilograms will always be a littler number than the pounds of a child, okay? So how do you know you to give the proper dosage? Well, again, milligrams times kilograms will figure out a dose, and then you figure out how much of the medication is there, and it's a desire over have times a quantity type of calculation. Tetracycline is an antibiotic that back in the 50s and 60s, it was one of the only ones we had. And what had happened is their teeth turned gray. So we don't give them ever to any child under the ages of 8 years old. Any questions? I apologize for no picture. I got to figure out what's going on with my camera.